Have you ever wondered how doctors navigate the human body with such precision? It all starts with anatomy, the foundation of medicine. Whether you are an MBBS student, a healthcare professional, or just curious about the human body, understanding anatomy is the key to mastering medicine. In this video, we'll cover what anatomy is, why it's crucial, and the basic terminology you need to get started. What is anatomy? Anatomy is the branch of medical science that studies the structure of the human body. It can be divided into several types. The first type is gross anatomy. Gross anatomy is studying the structures visible to the naked eye. Then the microscopic anatomy, the histology and cytology. It is the studying of tissues and cells under a microscope. Embryology deals with understanding how the human body develops from a single cell. Clinical anatomy is the practical application of anatomical knowledge in clinical practice. Why is anatomy so important? Every medical professional, whether a doctor, surgeon, or physiotherapist, uses anatomy to diagnose diseases, that is, understanding organ locations and structures, perform surgery safely, knowing where the arteries, nerves, and organs are, interpreting medical languages like X-rays, MRI, CT scans, and administer treatments like injections where precise anatomical knowledge is essential. Before we go deeper into anatomy, let's understand some basic terms used to describe the human body. Anatomical position, the standard reference position, standing upright, facing forward, palms facing out, is known as the anatomical position. Now coming to the planes of the body, the first one is the sagittal plane. It divides the body into left and right part. The next one is the coronal plane. It divides the body into front and back part. These two are named after the sutures, the sagittal sutures and coronal sutures, about which we'll further study. The transverse plane, as it is evident from the name, divides the body into upper and lower part. Now coming to the directional terms, superior means above and inferior means below. Anterior means front and posterior means towards the back. Medial means towards the midline of the body and lateral means away from the midline of the body. Proximal means closer to the origin and distal means farthest from the origin.